Thanks for joining. My name is Bill Reisacker, and today we're going to be talking about NovoPlexus, blockchain infrastructure and software platform for faster, easier, and more secure healthcare. Now we're going to go through a very common case scenario. Scott is seeing Dr. Davis for intermittent chest pain, which he has had for the past 5 years. He has seen several cardiologists at several different institutions and has had EKGs and stress tests at some of these places. He does not have the results with him, but Dr. Davis would like to see them to know how best to proceed. So she tells Scott to get all of his records, then come back in a month. Scott calls each cardiologist he saw to request his records. Some ask him to fax a signed request into the office, and some ask him to contact the hospital where the EKGs and stress tests were done. He has a hard time getting in touch with the right people in the hospitals. A few of the hospitals require him to pick up his results in person. After a week, he calls back some of the cardiology offices, which tell him that they never received his fax, so he resends them. In a few weeks, he calls Dr. Davis, and her staff reports that they still have not received some of the necessary reports. When he calls the other offices, they say that they were faxed, and he should call Dr. Davis's office again. After a month of frustration, Scott's chest pain returns. Now let's see how Scott does when everyone in his health network is connected to the NovoPlexus blockchain. But first, let's explain a little bit about blockchain. While current networks use a central server to store all data, blockchain is a decentralized network, so all transactions are encrypted and stored in chronologic order in an unchangeable packet of data called a block. A transaction can be an exchange of money, a patient encounter, a prescription, or even a search for previous data. All of these blocks linked up together are called a blockchain. And where does this chain live? A copy of it lives in each location or node in the network. This network is extremely secure because stealing information from a block would involve breaking into the same block in each node within a short amount of time, which is practically impossible. And the blockchain network centers around the individual's unique identification, so no one can see someone else's information without permission. Right now, electronic medical records, or EMRs, cannot talk directly with each other and share information. But with NovoPlexus, all the people in the network can communicate with each other through the blockchain with specially connected applications, which are programs that exist on a phone, laptop, or desktop. The people in the network include patients, doctors, pharmacists, hospitals, insurance companies, and anyone else who plays a role in healthcare. The blockchain knows how and where to move data based on smart contracts, the traffic cops of the blockchain layer, and there is no limit to the number and diversity of apps that can be added to the network. With NovoPlexus, Scott is in total control of his health record. So now, when Dr. Davis wants to see his records, he simply logs into NovoPlexus using his unique blockchain identity. He enters a search request for office notes from each cardiologist he's seen in the past 5 years, as well as the reports from each EKG and stress test done. He grants Dr. Davis permission to view these records for the next 3 months, which can be extended if needed. The records arrive on Dr. Davis's laptop in less than 1 minute, and she is able to determine that he needs a beta blocker medication. She sends a prescription to the pharmacy, another transaction added to the blockchain. By using NovoPlexus, she can see right away that they have it in stock, and she can even tell Scott how much it will cost him. Scott's a happy man. This is just one of many ways that NovoPlexus adds value to healthcare. For more information, please visit us at NovoPlexus.com. I'm Bill Reisacker. Thanks very much.